manager, but in that title I do the commissioning for Headstart Wolverhampton as well.
Okay, so we did have a very detailed presentation, and then we found out we had 30 minutes. So what we've decided to do is really keep it focused on how we respond to COVID-19. And Duncan and Maya will give you some more detail around that in terms of what we've supported. But just to give you some context, so Headstart and Wolverhampton, we don't cover the citywide. We cover geographical areas. So and we work in a certain number of schools, not all schools around that. And the important thing to say is that since Headstart's been in place now for 4 years, and we started working on sustainability before COVID-19 sort of impacted. So most of that work has been driven through our hashtag Yes Youth Engagement Strategy. I think it's just to build on what Scott said. It's very much about a whole systems approach. Headstart does not work in isolation whatsoever. In terms of our strategic governance approaches, we do have an emotional mental health wellbeing board, and that looks at wellbeing across the city. It's jointly chaired by a senior person within the local authority and a director of the CCG, and it does have multi-agency representation, including representation from the school. So that takes on the broader systems, and Headstart feeds into that. And it doesn't just look at sort of school wellbeing, it looks at things that are happening in the community, the referral pathway, very much a whole systems approach. And it's really because of that whole systems approach that Headstart has been embedded. So when COVID-19 did hit us, we were able to respond sort of really quickly, and we adapted and we were really flexible. So just to give you some background into it, Duncan's going to talk about what we did pre-COVID from a school perspective, and then Maya will talk about what we did from a community perspective. Again, what Headstart realised is that wellbeing is not in isolation. It's not just about the schools doing well, about wellbeing of pupils. It's about what happens in the community. It's about what happens in the home as well. So it is about taking that whole approach, that whole family approach. So Duncan, I'm going to hand over to you. Can you just give a brief overview about what we did sort of pre-COVID?
Yeah, of course. Do you want to put the slide up, Coach, or are you just going to not bother?
Yeah, I will.
It doesn't matter if not, because I'll start talking anyway. Okay, so hi everybody. What we sort of doing pre-COVID, we started off in the schools with the sumo approach, the stop, understand and move on. But like Scott was just saying about the co-production, from our local evaluation measures and our wellbeing measurement framework, we decided to move on slightly from the sumo approach, and we developed a wellbeing toolkit, which is, thank you, Kush, which is an approach where the delivery is around the 5 ways to wellbeing. It's so a universal approach. And the wellbeing toolkit encompasses things like empathy, resilience, handling emotions, problem solving, growth mindset, and aspirations. As I say, we got all that sort of information that we needed to make the toolkit from what the young people were telling us. And also the program, along with our HYPE program, which is the Headstart Young Person Empowerment program, which is a focused self-esteem program, and our Heroes program, which is a slant on peer mentoring. Those 3 programs that we deliver in the schools, they cover in its entirety the new RSE regulations for the wellbeing and mental health section that was being mentioned earlier on. And so that's what we were doing in schools before. We actually did hit all of our reach figures before March, because we're rolling out to other schools in the city at the moment. That's what we're hoping to do as we move forward. So we hit the targets before we left, before the end of March. But moving forward, we'll talk about that in a little while. What we're going to be doing moving forward, and what we did during lockdown. Okay, Kush?
Yeah, Mike, can you give an update on communities?
Yeah, hi everybody. Headstart in the community, the agenda has been very much driven by children and young people. And our Headstart ambassadors and Headstart mini ambassadors right at the beginning were instrumental in telling us what they would like to see as part of Headstart in the community. And a very important message we were given from them right at the beginning was that they wanted a link between their school and activities in the community to go to, where they could talk to trusted adults. So we did a series of commissioning exercises for which I had young people sitting on the procurement process with me. And so we appointed community providers in each of the 4 areas who developed a host of different activities for children and young people and their parent carers. And these providers were also trained and learned all of the same programs that my colleagues in the schools were delivering, so they understood the language, so they could use the same language with the children and young people when they attended the community activities. There's also always been an equality strand to Headstart Wolverhampton, and before COVID we commissioned a series of pilots where a specialist expert from one of our target groups, for example LGBT plus or BAME or SEND, worked with one of our community providers and a Head Start school to run a pilot which was suggested by some children and young people. For example, the LGBTQ young people told us that they wanted schools to have a better understanding of how to manage that community within their schools, how to talk to them, how to address them, how to make it all inclusive. I could talk for hours about this. I've got to say as well that our parent carers sit on the strategic children and young people emotional wellbeing partnership board that Kush mentioned earlier. So they're involved at the very top and at the bottom, designing activities for our children and young people. I'll stop there.
Okay, thank you. So I suppose that just gives you a snapshot. I mean, as part of Head Start, we do have sort of a parent work strand, we do have a workforce work strand, a media campaign as well, but we just try to keep it focused on how we responded to the pandemic. So as you know, the pandemic hit. I'm not sure if everybody knows, there's COVID-19, it's out there. And in terms of what we did during lockdown, so when I talk about lockdown, I'm talking about kind of the time from March up until August. So it's about how we responded. And I think what's important to say is that, again, we were very well positioned to respond to COVID-19. As part of some of that work, we did we've made sure there's regular contact with young people. We did a survey as well, and what we found from the survey is that actually young people and parents, they were doing okay. So despite a lot of the national coverage in terms of mental health really deteriorating, we found in Wolverhampton that overall the kids were doing okay. There were issues. I think the PHE colleague mentioned that there was anxiety and loneliness. Young people were saying they missed their friends, they actually missed their schools and their teachers, and they wanted to go back to some normality. Parents, if anything, they had heightened anxieties with the financial issues, with people being furloughed. So there was more anxieties from young people. And when talking to schools as well, so yesterday we were in another session with schools. Again, the schools echoed that there was a lot of anxiety when the schools were about to start, but actually when young people did go back, it wasn't as bad. So that kind of echoes the survey findings. And I think that's because we continued that lockdown. So again, you'll hear from a school perspective and what we did from a community perspective. And in the meantime, if anybody have got any questions, if you do want to raise your hands, what we'll do is we'll try to answer questions as we go along. So over to you, Duncan, what we did during the lockdown.
Okay, so obviously we couldn't go into schools to deliver any of our programs. So what the first thing that we did was we created a wellbeing pack for the young people and for the schools based around the 5 ways to wellbeing. And we tried to keep it fun because obviously everybody's quite, down with lockdown and all that sort of stuff. So The activities that we got in this pack, all quite light-hearted, around the 5 ways to well-being, about connecting with others, about being mindful, about giving, and all those things about being the 5 ways to well-being. Now, I've got that pack, and if anybody wants that pack, we can send it on to you if you'd like. It's quite a nice little package for young people to do. We worked quite closely with our comms team, updating and creating a new platform website where young people and parents and carers and indeed teachers could all go for advice and for schools. We were doing weekly check-ins with the schools, with the teachers, to see how they were doing, and also to signpost them to any different support that they might need. And we were like a bit of a sounding off board a little bit for a lot of the teachers, you know, with their concerns. And Kush said we did the survey of young people, parents and carers. And I'll talk about that in a little while, about where we move forward from that. I also did a sort of ad hoc survey amongst teachers to see how they were feeling and how their young people were feeling, how they were coping, and what they would want moving forward. And we were told that although we weren't obviously delivering into schools, there was some concern over the summer holidays, that young people are going to get a bit, you know, neglected, but isolated during the summer holidays. So we actually worked together with the Way Youth Zone in Wolverhampton and with some of our other service providers, SIBO and WV10, and we did some virtual delivery on wellbeing to young people. That was really well received in the city. So we sort of like took it from the schools into the community over the summer holidays. So yeah, it was basically that, just that ongoing support that we were giving to schools, and the ongoing support to the young people through signposting to different places and creating different packs, different work packs. The schools, we were sending things to schools that they were putting on their own websites around wellbeing, that the young people and the parents could also access as well. So that's the sort of stuff that we were doing during the lockdown.
Okay, Mai.
Hello again. Obviously, because of COVID, our community providers and the children and young people who attended the activities had to have a change of thinking how things were done. And one of the biggest messages we got from the community providers and the children and young people was they wanted things to be as normal as possible, and happy activities so they could see their friends, have a laugh, do fun activities. So the community providers and the smaller commission providers changed their approach totally to delivery quite quickly. And because of COVID, things like food parcels were introduced. Doorstep support was a very important part of the offer, where those families didn't have the digital ability to log into Zoom sessions. We did yoga online where all the family joined in. They sent out cooking parcels, so a week later they cooked a meal. There was baking, you name it. They did a lot of things like that. And as Duncan said, the Wellbeing Toolkit was available to all our children and people online, as were all the activities through the summer squad. And going forward, I don't know how long, nobody knows how long COVID's going to last, but because of the extension of Headstart, we'll be working with our children and young people in a locality-placed commissioning approach, where we'll have a young people partnership board, we're calling it at the moment, but they'll probably rename that themselves when they've done their induction. And the community providers who've got all the experience of what works in their local patch will work with those young people to commission further activities with the support of commissioning, to make sure that those localities get what the young people are telling us that they need, what the parents say makes them feel better, and what the schools say work for their children and young people after school. And another area of work that's come through is the need for some of the quality strand to continue, in particular the impact of COVID-19 on BAME, on SEND children and people, and the LGBTQ plus community. So we'll be looking at developing particular COVID aware support for those 3 areas of work going forward. And another area that we've picked up that needs to be thought about through our commissioning intentions process is support for fathers and support for parent carers. So yeah, we've got a lot of work to do in the next few months.
Okay, thank you,
Oh,
Mike.
I've got to say as well, I've forgotten my bragging bit. We've been setting up consortiums out in the community. So when Headstart eventually time expires, that some of this work can continue as part of our recovery plan for COVID-19. And some of the consortiums, and you'll see it on the slide, have already been very, very successful in bringing additional funding into those communities to plan and develop for this work past the end of the Headstart funding.
Great, thank you. Thank you, Mike. I think what we're really trying to draw across is that constant engagement with young people. So where we couldn't have face-to-face meetings, we went to the virtual forums, and in actual fact, our numbers of young people engaged has actually increased. Some people do like that online sort of platforms rather than face-to-face. It was easy for them to attend meetings. A big one we did was the summer program. So we knew that there were feelings of loneliness. Young people feeling anxious. Actually, families were saying the same as well. They were getting pretty fed up of sort of lockdown. So as the restrictions started easing, we started to develop our face-to-face activities. And again, Headstart was in a strong position because we had local providers, because we were already engaging with communities at very grassroots levels with young people. We managed to use that offer and actually broaden that offer as well. So we had sort of, not as good as last year, but we could offer a provision for young people. And I'm hoping this will go on to the next slide. So in terms of our Summer Squad 2020, during lockdown, we had a virtual offer. So we had about 100 activities on our virtual website. As lockdown eased, we worked with local organisations. We commissioned £120,000 worth of activities, and that was very much our grassroots organisations. Over 2,000 young people attended and 500 parents. In terms of the people accessing the website, over 21,000 new visitors. That really showed that families and young people wanted something to do, and we tried to mix up that. I think it was a huge success of the community organisations. I think they had about 3 weeks to turn around their risk assessments to ensure it was COVID compliant, to get the staffing in place, to get the activities in place, to do the communications. Again, because the Headstart were been active for 4 years, we were able to put together a sort of an offer really quick. As part of that sort of making it fun, and so during COVID-19, we heard a lot of the comms messages were, if you go out, if you interact with somebody, you're most likely to kill people. The amount of times I've had the comms message that if young people go to see their grandmother, they would kill them. From a Headstart point of view, it wasn't the message we wanted to give. What we wanted to say is, yes, there are restrictions, but families can still have a good time. So the holiday squad, the virtual squad, was part of that. And also some of the learning from the questionnaires where young people said, actually, they're missing their teachers, they're missing their schools as well. So we did thank the teacher day. Again, it was to say that the schools that were open, it was just to say thank you to the teachers for your support. We hope to see you again and things. So it's just something to give that positivity, and that's something that we so strongly believed in, that giving that positivity. So moving on, what next? Well, we know COVID-19 is still around. What Headstart Wolverhampton before COVID, we started working our sustainability plan, and that really was the launch of our youth engagement strategy, #yes. So within that strategy, we have 3 themes about being healthy, which is the mental health, physical health of young people. It was about being connected. So young people said they wanted to be connected to something, and that being connected can be to the family, to the schools, to the communities, to a trusted adult. It's being part of something. It's about having an identity. And finally, being you. And that really was about the ethos of Headstart. It's built on co-production, and being you ensures that co-production continues. You've heard some talks about the wellbeing returns. Headstart, we were one of the experts identified in terms of delivering that. We've been part of the link programs. We're currently working with our mental health support teams and using some of our learnings of Headstart, the program, and how that's built into the mental health support teams. Duncan, you're going to talk some more about the year four school offer.
Yeah, I will do. Just before that, I'll just quickly mention the new priorities identified. That's the second point down about school staff wellbeing. Daniela mentioned about the wellbeing education return programme, and we've been involved with that. We had some training with the Anna Freud Centre. And what we are in the process of doing is setting up some twilight meetings with school staff after half term with pastoral leads in the school to support the staff around their own well-being, because as Kush said, the young people are being quite resilient. Obviously they need help, but the staff need a little bit of help as well. And we're going to follow a model called the 5 R's, which is relationships, recognition, reflection, regulation and resilience. And so that's what we're going to be supporting the staff with. As far as the year 4 offer to the schools, it came back at the end of just before the summer break, that schools would like some sort of like transition work going back in September. And the new normal, if you like. So we did some virtual sessions around well-being and change, and also around growth mindset and empathy. So we've also already delivered that in a few schools. We're also going to be delivering our programs again in the schools this year, but it's going to look slightly different, obviously, because of COVID. A lot of it is going to be done virtually, and we've had to tweak and adapt our programs a little bit to do that, but that's not going to be a problem. But we are trying to move away slightly from delivery in schools. We are delivering in schools, but we want to do a more of a train-the-trainer approach. And that's going to help, you know, with the overall well-being of the schools and the sustainability moving forward. So we're hoping to train staff on using our wellbeing toolkit, on using our height program, and using our Heroes program. And incidentally, I don't think I mentioned before, the wellbeing toolkit that we did, it's actually going through the process at the moment of being accredited with the PSHE Association. So when that's all done, hopefully when that's all done, that's going to be available as an online resource through the PSHE Association.
Thank you, Duncan. I think we've got time, we're running out of time. Mai's already mentioned some of the work that we're doing around sort of commissioning and really hitting sort of kind of that locality-based commissioning. One of the things I do want to add is that the new thing that's come up is around school staff wellbeing. So we've not really focused on that, but what has really come out strongly from consultation, not only with Headstart schools, but from education psychologist teams as well, is that it's about how do we support staff well-being. So we will be commissioning the education psychologist team to pull together a bespoke program around that, and that does include the peer support, the peer mentoring, just offering some sort of chill out time for school staff to just think about their feelings and how they're adapting, and to be a sounding board for schools as well. So that's something that's a big area of work that's come out of COVID-19 as well. I think the biggest thing to say in this is that, as I mentioned, our young people seem to be a lot more resilient. Yes, we do have issues, and we've all worked throughout that. Our count referrals did not increase as we expected. And that's some of the evidence base of that is that because we kept that ongoing communication with the young people, with the schools, and with parents and with communities. by ensuring that by working together, we managed to, hopefully, the evidence speaks for itself in terms of how young people adapted when they went back to school. We didn't have a huge influx of early health assessments in terms of that additional support. Our sort of tier 2 emotional well-being service said that the numbers had been steady throughout the year. They didn't see a huge increase in demand. So that's some of the anecdotal evidence of some of the impact Headstart have made. As Scott mentioned, Headstart has been rigorously evaluated by the Anna Foyd Centre, so we do have the hard evidence of the Headstart programme and the impact that it's made, but we do have some of the qualitative information as well. I'm not sure whether we have time for questions, but if people do have any questions, if you want to raise your hands, we will try to answer them. Or
sorry, Kush, can I just say there are quite a few questions in the section. There's no way we're going to get through them. I was wondering, is this going to be stored? Is this something that we can get back and answer the questions afterwards? And also, there's some people that would like the packs that we developed. That's fine, as long as I can access this afterwards and get them sent out to you. That's fine.
Yeah, yes, I think we will be able to answer the questions that we can't answer today. I think we will be sent the questions where we'll need to respond. But before we get kicked, I think we will get kicked out at some point. So if people do have any questions, if you want to raise your hands now, we'll try to get through some of them now. I can't see any hands raised. Right. I'll just answer. So one of the questions from Nat Smith was, did parents get support for supporting their children during the lockdown, during the learning? Not as much, and that was some of the things that did come up as an issue. So the anxiety, the surveys that came back, it was primarily from the parents about their anxiety into sort of educating their young people at home as well. So that's something that we will be picking up in case we do need to go into sort of another lockdown. I did see a hand raised. Does somebody want to speak out about the question, or has the hand's gone down? Okay, no. Sorry, I've just got my children at the door. I'm just going to answer the door. Mai, do you want to take another question? Do you want to pick up another question?
Yeah, if anybody's got another question, I've got to say as well, I'll just add in about the parent carers. Some of their anxiety was dealt with by the community providers, and a lot of the volunteers, I have to say, were so fantastic in knocking doors, delivering the food parcels, and talking to a parent carer just for 20 minutes about how they were, if they were coping, if they wanted an activity pack, how they felt about the school kids going back to school, or if they were in school, if they were key workers. Yeah, the parent carers did really well, especially our volunteers. They were really good. I think we're being shut down, aren't we?
Looks like it.
Thank you so much for a really brilliant and informative session. We might have to bring this to a close now, just so people can have 5 minutes before the next session starts. Hopefully you can hear me now, but I can send you any questions remaining in the chat, if that's okay with you, for you to maybe answer them after the session ends, and we can get them back to everyone to ask questions. But thank you very much for your time.
Thank you. See you later.
Brilliant. Thanks, everyone. And
Bye.
if you haven't received a second workshop invitation, please email Tamara, or let me know, and I can send you her email. Thanks, everyone.
Can you hear me?
Yeah, I'll see you guys in the second workshop. I think, what time's the second workshop?
2, I think.
Oh, was it? Oh, it was 2:45. So we've got a 15-minute.
I think we've got 15 minutes, yeah.
Is it 2:45 or 1:30?
Hang on, let me have a look at the agenda.
Sorry, I was just.
Oh no, workshop 2. Sorry. Yeah, sorry. We've got 10 minutes, 1:30, yeah.
Sorry, I realised that's not very long.
Oh, is it
Yeah.
1:30?
Okay.
Right. I'm going to go and make a drink.
Yeah.
Right. See you in 5, guys.
See ya.
See you in a bit. Bye.